This is Dr. Jacome, bariatric surgeon from Augusta, Georgia. The topic of today is we're going to talk about Ozempic. Ozempic is a medication that is part of a much bigger group that is called the GLP-1 agonist. What are these type of medications? These have several effects. One, it helps with the efficiency and control of blood sugar by increasing the insulin production, decreasing the glucagon production, but also affects in many different ways how the GI tract works, especially slowing down the transit of the stomach. How does this medication work for weight loss? Is because it decreases the transit of the stomach, increasing the sensation of fullness, as well as increases the efficiency in the use of glucose, as well as the efficiency of the production of insulin. This results in a dramatic weight loss. Where do these medications actually come from? These medications came from the fact that we learned through bariatric surgery that the increase in levels of GLP-1 significantly affect weight loss. I'm going to mention a little bit about another medication called Wegovy. Wegovy belongs to the same family of Ozempic. Ozempic was the first medication that came out, and Wegovy is the first medication that has been approved for actual weight loss. Both medications have very similar effects, although the reasons to prescribe it may be a little bit different. Ozempic is more guided towards patients that have diabetes, and Wegovy more for weight loss, but both have the same essence on how they actually work. Now, a question that comes up at this point is whether Wegovy or these GLP-1 medications are good for bariatric patients. So the answer is the way obesity is seen at this point, or the way it should be seen, is that obesity is an actual disease, and these medications will help the disease and will help reduce the weight, but doesn't really do much to actually help the patient change their dietary habits and have a much healthier life. When it comes to bariatric patients, defining them as morbid obesity, which is a body mass index over 35, I believe that these medications can create a dramatic change, but they won't be able to do what bariatric surgery does. So what I'm advising to my patients right now is before surgery, you also gotta try to maximize your chances of losing weight through medical weight loss, and this could include these medications. Now, using these medications will actually create the change while you're taking the medications. So the moment that the medications are not taken anymore, the risk of weight regain is very significant. The ideal would be a patient that had bariatric surgery that has been able to lose their weight and are having difficulty maintaining it. At this point, using the medications will be very beneficial for a bariatric patient. Some of the side effects of this medication, especially the ones that people feel, which is nausea, reflux, all those are related to the slowing down of the GI tract. So if your stomach retains food and your stomach is full most of the time, one of the symptoms that you can perceive is regurgitation of food, heartburn, as well as severe nausea. Some of the most severe side effects could be pancreatitis, difficulty controlling blood sugar, trouble with the liver, decreased blood sugars that could even make patients have syncopal episodes. Thanks for watching. Be sure to subscribe if you like these topics. We'll see you next time.